Today we're going to talk about the Zika virus. At Cal Olympic Safety we understand that your time is valuable. With your time in mind, we have prepared the following presentation to help you understand what you need to know about Zika, and how to protect yourself and your workers. Let's get started. Approximately 1 in every 5 people infected with Zika will develop symptoms. Symptoms usually begin 2 to 7 days after being bitten by an infected mosquito. They are usually mild and can last between 2 to 7 days. The most common symptoms are fever, rash, joint pain and red or pink eyes. Other symptoms include muscle pain and headache. These symptoms are similar to those of dengue fever and chikungunya. In the most recent outbreak, some neurological and autoimmune complications have been reported. During the first week of infection, the virus can be detected in the blood and is possible to transmit the virus. In some instances, direct contact with the blood or body fluids of an infected person may result in transmission of the virus. The Zika virus can be transmitted from a pregnant woman to her fetus, and has been linked with a birth defect of the brain called microcephaly. Other birth defects have been reported that have been linked to Zika, including absent or poorly developed brain structures, defects of the eye, hearing deficits and impaired growth. The CDC recommends special precautions for women who are or may become pregnant and their partners. It is recommended that employers take the following actions to help protect outdoor workers and those at risk of occupational exposure to Zika virus. Inform workers about their risks of exposure. Provide insect repellents and encourage their use. Provide workers with clothing that covers hands, arms, legs and exposed skin. Consider providing hats with mosquito netting to provide a cover for the face and neck. Encourage workers to wear lightweight, loose-fitting clothing in warm weather. Always provide workers with adequate water, rest and shade and monitor them for signs of heat illness. Eliminate sources of standing water and train workers about the importance of eliminating areas where mosquitoes can breed. Common sources of standing water include tires, buckets, cans, bottles and barrels. If requested by a worker, consider reassignment for those who are or may become pregnant, or for those who have a partner who is or may become pregnant. The following guidance has been issued on the use of insect repellents. Always follow label precautions when using insect repellent. Use insect repellent containing an EPA-registered active ingredient. Choose a repellent that provides protection for the amount of time that you will be outdoors. To avoid a reaction to DEET or other ingredients in insect repellents, read and follow the directions on all insect repellents before use. Do not spray insect repellent on skin that is under clothing. Stop using insect repellent and/or sunscreen if a rash or other adverse symptoms develop. Do not apply insect repellent to skin that is already irritated, or to cuts or lacerations. Do not spray aerosol or pump products in enclosed areas. Do not spray a pump or aerosol product directly on the face. Use soap and water to wash skin that has been treated with insect repellent after returning indoors and before eating, and remember to reapply insect repellent before returning to work. Use separate sunscreen and DEET containing insect repellents. Apply sunscreen first and remember that you may need to reapply sunscreen more frequently. The CDC advises individuals, including workers, infected with Zika virus to get plenty of rest. Drink fluids to prevent dehydration. Take medicines such as acetaminophen to reduce fever and pain. Avoid taking aspirin, ibuprofen, naproxen or other NSAIDs because of rare cases of bleeding occurring with flaviviruses and these medications. Talk to a healthcare provider before taking any medications, including prescriptions, for other medical conditions. To help prevent others from getting sick, avoid mosquito bites during the first week of infection, wear clothing that covers skin and use insect repellents to help prevent bites. To help prevent transmission to partners via sexual contact, abstain from sexual activity or use condoms during sexual activity during and following infection. Employers should ensure that supervisors and all potentially exposed workers are aware of the symptoms of Zika. Train workers to seek medical evaluation if they develop symptoms of Zika. Assure that workers receive prompt and appropriate medical evaluation and follow-up after a suspected exposure to Zika virus. If the exposure occurs under OSHA's BBP standard, employers must comply with the medical evaluation and follow-up requirements in the standard. Consider options for granting sick leave during the infectious period. This presentation is not a standard or regulation, and it creates no new legal obligations. It contains recommendations as well as descriptions of mandatory safety and health standards. The recommendations are advisory in nature, informational in content, and are intended to assist employers in providing a safe and healthful workplace. The Occupational Safety and Health Act requires employers to comply with safety and health standards and regulations promulgated by OSHA or by a state with an OSHA-approved state plan. In addition, the Act's General Duty Clause, Section 5A(1), requires employers to provide their employees with a workplace free from recognized hazards likely to cause death or serious physical harm. This information has been presented to you by Cal Olympic Safety. Since 1958, Cal Olympic Safety has provided customers with a complete line of safety products for the industrial worker. Cal Olympic Safety's ongoing commitment to customers is to provide the most effective safety products possible at the best value available. Call today and find out how Cal Olympic's expertise and quality safety products can benefit your company. Visit Cal Olympic on the web at www.caloli-safety.com.